Hi, it's Dr. Brian McDonough, and welcome to the Dr. Brian McDonough Show. You may or may not know it, but we are facing a crisis in medicine here in the United States and around the world. I just read a story about a physician in Donegal who was a private practitioner since the 80s. She's retiring. There's no one to take her place in a small town. Here in the United States, we're seeing something quite similar. It's different health system, different approaches, but we now have a situation where 46.7% of physicians are over 55. Greater than half of the physicians basically wanted to change their employment plan after getting through COVID, all the pressures of that and providing care in that environment. 20% are considering early retirement. So that's one issue, an aging physician population who are trained to do things a certain way. The other issue is that younger physicians, and I train them all the time, they're full of energy, they're full of hope, they want to make a difference. Well, these younger physicians are entering an employed model, which we really didn't enter when we were young. Back in 2012, 6% of physicians were employed. Now it's about 56%. When you're employed, you kind of work 9 to 5. Your boss plays the music and you kind of dance to the music that's being played. More and more of that music is being played on a computer system. The computer system has metrics and numbers and things you have to fill out. That's less time with the patient, more time doing paperwork. Physicians are frankly burning out. In fact, last year, 40% of physicians left their practice. 40%, this according to the MGMA, left their practice due to burnout. And the real issue here is it's a lack of independence, reduced feeling that you're impacting, helping your patient, providing care for them, the FaceTime, those things, and all this time on the computer, whether it's insurance documentation for payment, whether it's quality studies that are being pushed down by other organizations. Doctors are now clicking buttons and they're not necessarily looking in the patient's eyes and really finding out what's wrong with them. It looks good on paper, but it may not necessarily be the quality care and personal care done in the past. Again, I'm presenting the negatives because people are leaving. There are positives. For instance, the standardization of care and the fact that evidence-based medicine is starting to become more and more popular and widely used is going to help care, because it's not just somebody in their own world thinking what's best for a patient based on their own experience. They can share the experience of many others because of these computers. But this being said, we're at a point now where if physicians, essentially those who have the most extensive training and the greatest amount of investment by their communities, whether it's through tax dollars or others to give them that extensive training and training beyond medical school, if they start leaving, they're not easily replaced. We have a big team. We have physician assistants, nurse practitioners, obviously nurses, and we have therapists, a lot of people doing wonderful care. But those that have had the 4 years of medical school, the residency training, and all that money and time poured into the education, every time you lose one of them, you're losing a wealth of information, and it's hard to make that up. So right now, we're in a situation in our country where we need people to more or less bring the administrators, let's say at the hospital level, the C-suite, together with the providers. It's not fair for a business person to be expected to understand what doctors do or what motivates them. It's not fair for a doctor to necessarily understand what executives are doing. Because of that, you basically need people to bring them together to have that conversation. And most importantly, you need patients to express their views. Do they feel they're getting the care and the time and the commitment they deserve from their doctor? Or do they feel they're kind of in the system, just a cog in a wheel? Hopefully you found this helpful, and thank you once again for listening to the Dr. Brian McDonough Show. Please subscribe, like this program, and watch or listen to our other content. It's here to help, and hopefully you do find it helpful.